Papua New Guinea's healthcare system is facing a crisis of immense proportions. Years of underfunding, mismanagement, and a lack of political will have left the system in a state of disrepair. Many healthcare facilities are dilapidated, lacking essential equipment and medicines. The shortage of qualified medical professionals, including doctors, nurses, and technicians, further exacerbates the problem. This dire situation leaves a vast segment of the population without access to even basic healthcare services. The geographical challenges of this island nation, with its rugged terrain and remote communities, complicate healthcare delivery. Transporting medical supplies and personnel to these areas is often difficult and expensive. This geographical isolation further marginalizes already vulnerable populations. The lack of reliable infrastructure, including roads and communication networks, hinders effective healthcare delivery. The combination of these factors creates a perfect storm for a healthcare crisis. The consequences of this failing healthcare system are devastating. Preventable diseases like malaria, tuberculosis, and pneumonia continue to claim lives, particularly among children and pregnant women. Maternal and child mortality rates remain alarmingly high. Access to specialized care for chronic conditions like heart disease and diabetes is severely limited. This crisis demands urgent attention and a comprehensive overhaul of the healthcare system. The current state of healthcare in Papua New Guinea is a stark reminder of the inequality that pervades the world. While developed nations enjoy access to advanced medical technologies and treatments, millions in Papua New Guinea struggle to receive even the most basic care. This disparity is a moral indictment of the global community. Addressing this crisis requires a concerted effort from both the Papua New Guinean government and international partners. The future of the nation depends on it. Papua New Guinea's population is growing rapidly, placing an even greater strain on its already fragile healthcare system. Current estimates put the population at over 9 million, and projections suggest continued growth in the coming decades. This demographic expansion will further exacerbate the existing shortages in healthcare facilities, personnel, and resources. The government must act decisively to address this looming challenge. The increasing population density in urban areas is particularly concerning. As more people migrate to cities in search of economic opportunities, the demand for healthcare services in these areas intensifies. Existing urban healthcare facilities are already overwhelmed, and the influx of new residents will only worsen the situation. This urban concentration of healthcare needs requires targeted interventions. The growing population also presents challenges for disease control and prevention. Overcrowded living conditions and limited access to sanitation increase the risk of infectious disease outbreaks. The healthcare system must be equipped to respond effectively to these public health threats. Investing in preventative measures is crucial to mitigating the impact of future epidemics. Without proactive measures to expand healthcare capacity, the growing population will further overwhelm the system. The consequences of inaction are dire, with potentially catastrophic implications for public health. The government must prioritize healthcare investments to ensure that the growing population has access to essential services. Failure to do so will jeopardize the health and well-being of future generations. The ratio of healthcare facilities to the population in Papua New Guinea is alarmingly low. The limited number of hospitals, clinics, and health centers is insufficient to meet the needs of the growing population. This critical imbalance is particularly pronounced in rural areas, where access to healthcare is often severely restricted. This disparity underscores the urgent need for increased investment in healthcare infrastructure. The scarcity of healthcare facilities leads to long waiting times, overcrowded conditions, and a diminished quality of care. Patients often travel long distances to reach the nearest health center, only to face long queues and limited resources. This situation discourages people from seeking timely medical attention, leading to delayed diagnoses and poorer health outcomes. The lack of specialized facilities is another major concern. Patients requiring specialized care, such as surgery or cancer treatment, often have to travel abroad, which is prohibitively expensive for most. This lack of access to specialized care exacerbates health disparities and perpetuates the cycle of poverty. investing in specialized facilities within the country is essential to improving health outcomes. Addressing this critical imbalance requires a multi-pronged approach. Building new healthcare facilities, particularly in underserved rural areas, is crucial. Recruiting and retaining qualified healthcare professionals is equally important. Improving infrastructure, including roads and communication networks, is essential to facilitate access to remote communities. These investments are essential to ensuring equitable access to healthcare for all citizens. Section 4, Southern Highlands Province, a case study in neglect. Southern Highlands Province, or SHP, exemplifies the challenges facing Papua New Guinea's healthcare system. The province suffers from a severe shortage of healthcare facilities, qualified personnel, and essential medicines. Access to healthcare in SHP is particularly limited, with many communities completely isolated from even basic services. This situation highlights the urgent need for targeted interventions in this region. The few existing hospitals and health centers in SHP are often understaffed and ill-equipped. They struggle to provide even basic medical care, and their capacity to handle emergencies is severely limited. This lack of adequate healthcare services has devastating consequences for the population of SHP. Public services in SHP are often unreliable or non-existent. Ambulance services are limited, and the poor condition of roads makes transporting patients to healthcare facilities extremely challenging. This lack of reliable transportation further hinders access to timely medical care. The situation in SHP is a stark reminder of the inequalities that exist within Papua New Guinea. While some regions have relatively better access to healthcare, others like SHP are left behind. Addressing these disparities requires a commitment to equitable resource allocation and targeted interventions in underserved areas. Section 5. Governmental accountability and the spectre of corruption. The Papua New Guinean government bears the primary responsibility for addressing the healthcare crisis. However, years of inadequate funding, mismanagement, and alleged corruption have hampered progress. The government must demonstrate a genuine commitment to improving healthcare by increasing budgetary allocations, strengthening oversight mechanisms, and promoting transparency. Corruption within the healthcare sector diverts scarce resources away from essential services. Allegations of misappropriation of funds, procurement irregularities, and ghost employment undermine public trust and erode the effectiveness of healthcare programs. Combating corruption requires robust anti-corruption measures and enhanced accountability. The lack of transparency in government spending on healthcare further fuels suspicions of corruption. The public has a right to know how healthcare funds are being utilized. Greater transparency will promote accountability and help ensure that resources are used effectively. The government must prioritize healthcare as a fundamental human right. Investing in healthcare is not merely an expenditure, but an investment in the future of the nation. A healthy population is essential for economic development and social progress. The government must fulfill its obligation to provide quality healthcare for all citizens. Section 6. Charting a path forward. Recommendations for change. Addressing Papua New Guinea's healthcare crisis requires a comprehensive and multifaceted approach. Increased investment in healthcare infrastructure, including building new facilities and upgrading existing ones, is paramount. Recruiting and retaining qualified healthcare professionals, particularly in rural areas, is crucial. Strengthening primary healthcare services is essential to preventing disease and promoting health. Investing in community health workers who can provide basic healthcare services in remote areas is a cost-effective strategy. Improving health education and promoting healthy lifestyles can empower individuals to take control of their health. International partnerships can play a crucial role in supporting Papua New Guinea's healthcare efforts. Donor agencies, NGOs, and other international organizations can provide technical assistance, financial support, and capacity building. Collaborating with international partners can help bridge the resource gap and accelerate progress. Ultimately, the success of these efforts depends on the political will of the Papua New Guinean government. The government must prioritize healthcare as a national imperative and demonstrate a sustained commitment to reform. Only through concerted action and sustained investment can Papua New Guinea overcome its healthcare crisis and ensure a healthier future for its people.